Many patients ask us, what are some stretches you can do? And honestly, the first thing you should do is start while you're in bed, especially for low back pain patients and SI joint dysfunction issues. The first kind of couple of things we're gonna do is just this. It's very simple and very easy to do. And it's just kind of taking that one leg and just kind of going back and forth, left and right, and then incorporating the left leg in as well. And this is opening and closing the SI joints, and then side to side, work the joints a lot more, circles with the feet, warming up the ankle joints, other way, bring one foot on top of the other. This stretches a little bit of the calf, the Achilles, and kind of warming up the hips as well. And then moving it into the other side. Also, you'll notice when you do the internal rotation, the weight of the leg on top gives a little more of a stretch inward, which opens up the low back. Good. Bring your knees in. Bring one knee up to your chest, and then once it's up, you're gonna straighten the other leg out, and you'll feel a little more of a groin stretch in here a little bit. It's really tight, and there's no really set time you want to hold this. If it feels good, keep doing it, and then bring the other side up. Hold it here for a bit. Leg will stretch down, and once you bring this in, it's all warmed up here. You're gonna bring both knees in and stretch from this side to side. So we're making this motion in here. Open and close, some clamshells, kind of waking up the lower body. If you're on the side of the bed, you can also drop a leg down and open up the hips from here. Getting a little bit of the hip flexors open up as well. If you're on a small baby-sized twin bed, this is great, but if you're on a king-size bed, you're gonna have to move all the way over to the other side. Same thing here. And you're just kind of waking up the body, getting yourself nice and limber. And then I like to do a figure 4, where you're bringing the leg over, letting the weight just kind of drop in. And then from here, if you need to do a little overpressure into the thigh, you can. You're pushing away from your body. You're trying to push the hip almost out of its socket. You should feel it right in the hip flexor. And then the other side as well. Open it up, a little overpressure here, good. And last but not least, a little bit of a little rocking up and down, a little pumping motion, nothing too crazy. And if you can, you start working into a figure 8 motion, waking up the low back, down, a little bridging motion up and down, follow the hamstrings, a little bit of the core. And then also really important is just go to the side of your bed, drop your legs over at the same time as you push up, and that protects your back. These are little things you can do in the morning to really make sure your back's warmed up, especially in colder months. Quick little exercise for you to do. Try it out, see how you feel.